Okay, next one is on physical therapy. The first question you have to ask is it post op? You can have neck surgery, low back surgery, shoulder surgery, wrist surgery, knee surgery, all kinds of surgeries in our body. And so there are two different guidelines for physical therapy. One for just regular physical therapy without surgery, and another one for post-operative care. So post-surgical physical therapy guidelines there's two, so you have to familiarize yourself with both, and we'll talk about them. So the first question you ask is it post-op and or not? And then the next question you got to ask is how many have they had? You have to figure out physical therapy history. Not all doctors. In fact, most doctors don't keep track of how many physical therapy they've had. Most physical therapy notes will say on top or at the end how many physical therapy they're scheduled and of which how many, which session they are on. Um, but many times there are no physical therapy notes provided, and sometimes there's not even any physical therapy treatment request, and we're asked to review for them. So you have to put a timeline together. And so the first thing I would start with just getting all the dates. Okay, get the utilization review date, because this is a letter that we are asked to dispute, right? So the process is a physician asks for physical therapy, utilization review company go, writes a letter, says, hey, it's not indicated. And so that date kind of gets you in the initial time frame, because it's got to be some time before that, not too much time before the utilization review date. But if the utilization review date is in November, the request must come in, in October or late September, because the time limit for utilization review is actually 2 weeks. So it should be around that time. And then you want to get the request date. And if you get hold of the progress report that has the request, that'd be great. If not, look for request for authorization for that particular physical therapy. And sometimes you might have three different RFAs with three different RFA dates, because doctors, when they don't get something authorized, they keep submitting it over and over and over again. And so even then, it's hard to figure out exactly which one you're requesting. Uh, Sometimes the Word file that comes in with the request will have the dates on there, which is great. But if not, we have to kind of figure it out and put a timeline together, okay? And then get any dates with prior treatments, PR2s, therapy notes. Um, if there are any reference to prior treatments, jot it down. For example, if the PR2 says, or progress report says, patient had 35 or 12 physical therapy in the recent past, or patient has benefited from physical therapy and request for additional 8, then you know that they've had some recently. And a lot of times they don't even say how many, but just jot down any reference to physical therapy so you can kind of reconstruct the timeline and the therapy history. And so when you read QME reports, or the independent medical evaluation, or the agreed medical evaluation, or also called the AME, sometimes there's another phrase called panel QME. But if these reports are fairly recent, they'll alert you to any physical therapy, because they're usually more comprehensive. And then also look for prescriptions. Sometimes there'll be prescription pads. I'm sorry, a prescription written up by the treating physician, and also RFAs, or the request for authorization. Anything, everything that can alert us to the physical therapy history would be helpful. Then read the reports to see how the patient is responding. Okay, surprisingly, this is not as important, but anything they say about physical therapy, what the treating physician says, jot it down. the MTUS really doesn't emphasize this except for post-surgical treatments. There's a phrase in post-surgical treatments guidelines where it allows for additional physical therapy than what's recommended, a number of sessions, if the patient is making good progress towards the goal. But for non-operative, non-post-surgical, the MTUS doesn't really talk much about patient's progress as a factor in making a determination as to how many they should have. So think of time frame and get the history. So let's look at the physical therapy guidelines. This is the regular physical therapy guidelines, non-post-surgical. It says, I forget the page. I think it's page 98. Allow for fading of the treatment frequency from up to 3 visits per week to 1 or less. Plus active self-directed home physical medicine. It just means that patients should be transitioned into a home therapy program, okay? So you give them a certain number, and the last few sessions or the final session, the therapist should be instructing the patient so that they can transition to home exercise program, and everyone does that. All the therapists do that. So the guidelines for number of treatments are simple. Look at this. Myalgia, myositis, unspecified. 9 to 10 visits over 8 weeks. Neuralgia, neuritis, radiculitis, unspecified. 8 to 10 visits for over 4 weeks. So we're not really going to pay attention to over how long it's prescribed, but we're just going to be paying attention to the number of visits. For all chronic pain, non-surgical chronic pain, pretty much, okay, it's going to be 10 visits. Just remember 10. You got muscle pain or you got nerve pain. What other pains can you have? You can have bone pain, you can have tendon pain, you can have joint pain. I wish they had said something about that, but tendon, bone is similar to bone pain. Joint pain, similar to muscle pain. And the rest of it, neuropathic pain or pain that comes from nerves. So it's all 10 visits. That's all they allow. I wish they were a little more specific. And then there's one other group of diagnosis, I shouldn't say group, but a diagnosis called reflex sympathetic dystrophy, or CRPS. If you see this under diagnosis, then you need to consider 24 visits instead of 10, but that's the only exception, okay? This covers nearly all diagnoses: back pain, neck pain. What else can you have? I've already talked about that. And this covers the rest. And then you've got this, okay? So basically 10 visits unless you have RSD or CRPS. But think about this. What about arthritic joint pain, tendinitis, flare-ups, okay? Doesn't talk about it. Maintenance treatments, when you look at chiropractic treatment schedule, it recommends 1 to 2 visits every 4 months for maintenance treatments if the patient is working. But for physical therapy, you would think that these chronic pain patients would require maintenance therapy, but it doesn't. So how about for functional improvement? There's no section on the regular physical therapy discussion or treatment guidelines that talk about how if the patient is making great progress, let's say the patient has really bad back pain, has had 10 visits, and the patient is making progress, was only lifting 10 pounds, but he's able to lift 30 pounds now, and the range of motion is improved, and the patient says the pain level is down to, from 8 out of 10 to 4 out of 10. You would think that the treatment guidelines should allow for more visits, but it doesn't talk about it. And so, as a physician for myself, I think we do need to make an argument. So my rule of thumb is if they haven't had any physical therapy for 1 year and the request is less than 10 or less, and they document something about flare-ups or functional improvement or they're struggling, then I'm going to authorize it. Okay, even if it's more than 6 months ago. So anything more than 6 months or a year ago, if the last therapy was 6 months to 12 months before the request, then I'm going to try to go for authorizing some of these and see if I get into any trouble with Maximus. But since they don't talk about it, we do have to allow for some, okay? And then physical therapy. Just think of numbers, okay? That's first of all, is it post-op? Then figure out a post-operative time frame to allow for post-op. Figure out how much they had. Figure out the time frame. If more than 10 for non-operative or more than post-op guidelines, then denial. Just get the numbers right. And then for post-operative, you have to read the post-operative, post-surgical guidelines. And for each of the type of surgery, okay, there's a specific recommendation. And for each surgery, they have the post-operative time frame. For most of them, it's 3 to 6 months. For example, after carpal tunnel release, they allow 3 to 8 sessions. So anything more than 8 sessions is pretty much automatic denial. I mean, you don't need a whole lot of therapy following carpal tunnel syndrome. If you've had lumbar fusion or cervical fusion, I think they allow 34 sessions. So any request that is up to 34 sessions, don't ask any questions, just authorize it if it's within the post-operative time frame. If the post-operative time frame is over, then it reverts back, okay, to regular physical therapy request. So let's say someone had surgery in June of 2013, and they had 40 or 30 or 40 sessions of post-operative therapy, and then now it's February of 2014, and the treating physician asked for 12 sessions. It's not post-operative guidelines anymore because it's been more than 6 months, right? Now you revert back to 8 to 10 sessions or 9 to 10 sessions for persistent back pain. So the limit would be 10 sessions. So theoretically, they can get 34 for postoperative following a fusion surgery in the lumbar spine. And then once the 6 months time frame is over, then they can get another 10 sessions. But after that, that's it. I mean, that's how the MTES guidelines is written. And then so after you get all this information, then write it out. Document what report said on what date. Always try to put in the dates and then weave a story together. And that's the difficult part, but keep working on it. And as you do more and more, things will improve. And that's it for physical therapy.